Hello, I'm Dr. Mini Nair, Founder and Chief Physician of Ayurveda and Siddha Hospital, 18th Main, Koramangala, Bangalore. There are veins and arteries in our body. The veins usually carry blood from the peripheries to the heart and the arteries from the heart to the peripheries. And these veins are usually they flow against the gravity, and so they have valves which actually helps in the upward thrust of the flow. So these valves sometimes becomes weak and they collapse and leading to pooling of blood within the veins, and that is seen as swelling or varicosities. This varicosity itself is not a very serious issue, but sometimes it can actually lead to various other complications like pain, swelling, redness, and then this becomes a complication. So before this, we need to definitely treat the issue. So this varicosity, why does this actually cause, is because there are various factors. The factors like standing for longer period of time or sitting for longer period of time. And women, sometimes it can be because of pregnancy or even post-menopausal, or in some cases obesity is also seen as a contributing factor for varicosity. When you're talking about Ayurveda, here the prevention is always the aspect here. So when we are looking on to prevention of varicosity, we need to understand that once this has already set into our system, then it is very difficult to reverse the condition. So when we know that we are sitting for a longer period of time, then definitely we need to take small breaks or shift our, the position from, if you're standing, then shift the pressure for various legs. Like if you're standing, putting the pressure on the right side of your body, then we need to move to the left, or then take small breaks, go around, walk, or keep your legs elevated for some time. These are some of the methods that you can prevent the varicosity from happening to your veins. But even sometimes in some cases we advise even massages. The massages that can be done is usually in the reverse order. Unlike what you do for the usual massages, this has to be given, the direction has to be towards the heart. But then we need to take care of some serious issues like deep vein thrombosis. That is, if you have clots within the veins, these massages can be more harmful than working as a preventive measure. Why? Because these clots tend to move, and then if they get lodged in the lungs, can lead to pulmonary emboli, which are more serious than the varicosities. So care has to be taken, or investigations has to be done before we actually advise or advocate this kind of treatment of massages. Once it is ruled out that the person does not have these clots within the veins, then massages can be done with pinda thaillam, sahcahradi thaillam, or prapabhanjana vimardana thaillam, kapasaswadi thailams, etc. But care also has to be given to see that obesity has to be ruled out, and how we need to prevent this obesity, and on top of that, healthy living style is also advocated.